I received my results next month, sometime in May of 2023. Those results showed a minute fragment of atypical squamous epithelial lesions, suggested of high-grade dysplasia. That's a mouthful, right? Yeah, and for me it was too. Even the providers that I work with, the specialists, they sometimes have to refer to these guidelines because every person is unique. Each situation is unique depending on your history. Have you had any abnormal pap smears? Did you have HPV tested? Was it HPV positive? Was it high risk HPV strains? So again, it's a lot that goes into making the decision whether to move forward with getting the colposcopy or waiting and retesting my pap smear. Hey everyone, welcome back to my channel. It's been a while. In today's video, I will be updating you on my journey since my last discussion about my abnormal pap smear. In November of 2021, when I received my pap smear indicating L-seal, following this, I underwent a colposcopy in January of 2022, which thankfully didn't show any additional high-grade lesions. I went into a whole lot of detail in that video regarding my initial concerns and how I was processing everything. I also showed with you that ASCCP tool that us providers use to help us decide the next steps when you receive an abnormal pap smear. So, as for the updates, since December of 2021, when I last released part 1 of my journey, I've had some significant developments. In December of 2022, I had another pap smear showing HSEAL, which stands for high-grade squamous intraepithelial lesions. So when these cells appear on a pap smear, it indicates that the cells have a higher likelihood of progressing to cervical cancer if not appropriately managed or treated. My pap smear also showed high-risk HPV, leading me to get what? Yes, another colposcopy. So in January of 2023, my colposcopy, it was not diagnostic, meaning the results were inconclusive because of scant tissue samples. This means that the sample they collected was too small to make a conclusive diagnosis. While it's not uncommon for initial colposcopies to be inconclusive, it did mean, however, that I had to undergo yet a third colposcopy. In April of 2023, that repeat colposcopy, it was performed. And I received my results next month, sometime in May. The colposcopy results indicated a minute fragment of atypical squamous epithelial, suggestive of high-grade dysplasia. That's a lot of words. Basically, what it meant was the tissue sample, it showed changes in the squamous cells that could suggest the presence of high-grade dysplasia, which is a more severe precancerous condition. I was concerned because high-grade dysplasia could potentially lead to cervical cancer if untreated. The problem was my OBGYN didn't like the results and felt like they were inconclusive and quite vague. So he explained to me he wanted to go down to pathology. He basically wanted to get a look at it for himself. So in July, he finally got around to reviewing my specimen. So at this time, my doctor, he did call, and basically he suggested that I get a colposcopy. Before I proceeded with another colposcopy, I told him that I wanted to know my options. I wanted to get clarity of my results. Actually, I'm gonna rewind because he didn't recommend that I get a colposcopy. He actually recommended that I get a LEEP procedure. I remember at that time I was not even trying to, I wasn't trying to get a LEEP. I wasn't trying to have surgery. Even getting a colposcopy again that's the furthest I had made it at that time, is agreeing to repeat the colposcopy. At this point, I really was just unsure of how I wanted to move forward. And I just felt like I wasn't informed enough. I'd recently graduated as a nurse midwife, and even the providers that I work with, the specialists, they sometimes have to refer to these guidelines because every person is unique. Each situation is unique depending on your history. Have you had any abnormal pap smears? When was the last time you had an abnormal pap smear? Did you have HPV tested? Was it HPV positive? Was it high-risk HPV strains? So again, it's a lot that goes into making the decision whether to move forward with getting the colposcopy or waiting and retesting my pap smear. So after all of that, we decided to go ahead and move forward with another colposcopy. Mind you, that would be my third colposcopy. In April of 2023 is when we had that repeat colposcopy, and I received my results next month, sometime in May of 2023. Those results showed a minute fragment of atypical squamous epithelial lesions, suggested of high-grade dysplasia. That's a mouthful, right? Yeah, and for me it was too. So a lot of this was new for me. So of course it kind of took me off guard, and I didn't feel very informed. There was a lot of things that I didn't understand reading these results. So basically, it's a very small tissue sample that showed changes in the squamous cells. And those changes could suggest that there's a presence of high-grade dysplasia or a more severe precancerous condition. So of course I was concerned because high-grade dysplasia could potentially lead to cervical cancer. So the problem was my OBGYN didn't like those results, and he felt like because the test was inconclusive and quite vague, he wanted to go down to pathology and basically have a look for himself. And then he would call me with his impression or his opinion, his medical opinion on what we should do next. So in July, it took a while. I had that colposcopy done in May. So he finally got back to me, and after looking at my tissue or my specimen, he basically suggested that I have a LEEP procedure. A LEEP is surgical procedure. They basically go in and remove parts of your cervix, hoping to get rid of any abnormal cells, any cells that are precancerous and have the ability to grow into cancerous cells, and get rid of anything that looks abnormal, and hopefully cut off or excise enough. So when you go back and you have your repeat testing, hopefully the results show that they got everything. So at this time I was in school, and it was the summertime, so I was traveling to and from Dallas for clinicals. I was both busy and distracted. I also was uncertain how I wanted to proceed. I told him I was ready to discuss my options, but I wanted to get some clarity on my results. I wanted to do some research, and I wanted to get an idea of what these results meant. August of 2023, I finally messaged my doctor. I actually messaged him online through the patient portal. I messaged him with additional questions about my options moving forward. I wanted to know, what if I wait and not get the LEEP procedure right away? I wanted to know, what are the chances of those abnormal cells turning into cancer cells. He responded on the app. He really wanted to reassure me that I had time to decide. The dysplasia wouldn't progress into cancer in this short waiting period. However, he did reply that there was a 25% chance of developing cancer based on that risk tool. When I read 25%, at that point I messaged him and I was like, okay, 25%, wow. I'm ready to schedule this LEEP procedure. I'm ready to basically, at this point, stop whatever that could possibly be growing and, just tackle it head on. When you look at the risk and the percentage or the chances of that dysplasia developing into cervical cancer, you'll see 25% is a very high number, a number that I didn't feel comfortable with. Not a number that I felt comfortable just waiting it out. So not long after that, I messaged him telling him, okay, I'm ready now. I'm ready to schedule this LEEP procedure. Even though I wasn't completely on board, like I wasn't 100%, but I knew it was something that needed to be done. I knew it was time sensitive and that the longer I wait to have the procedure, the more anxious that I become and the more risk of something developing that isn't already there. That was my main thoughts. So he called me to discuss my options in full and to kind of clear up my concerns. Again, he was great at reassuring me. When I waited to get that last colposcopy, he didn't think I should wait. He felt like your chances of developing cancer is low, but I still feel like you need this colposcopy. And what I wanted to do is kind of slow things down. I wanted to take my time and think about it and research alternative medicine and, the natural remedies. And I really was just not even wanting to have another colposcopy so soon. So it was a lot. Again, it was a lot of decisions that needed to be made, a lot of research and stressing about these results. So before I got to the point where I decided on the LEEP procedure, in between, it was a lot of time that had passed. I was taking natural herbs. I was working to increase my immunity with different supplements and vitamins. I started exercising more. My main focus was health and wellness. I began to get more serious about tracking my sleep, tracking my menstrual cycles. It was just a lot. I was just at a point where I wanted to holistically just get back on track. Even though I wasn't completely on board, part of me felt like LEEP was my only option. I felt as though I wanted to have one more pap smear before I had the LEEP. I wasn't 100% sold, so I did not have the LEEP at that time. Again, he didn't recommend that I wait. My doctor actually suggested that I move forward with the LEEP. I think because the test was showing different results and each result said something different, that felt to me like maybe if I continue on the path that I was on and I was doing the things that I was doing, that hopefully those cells would regress and the HPV would clear and I would no longer have these high-risk cells. I also do recall mentioning to you all in the previous video that for some time I was having chronic yeast and I was fighting yeast infections, and when you would treat the yeast you would get BV. So I felt like I was in that vicious cycle of trying to get my vaginal pH in order. A huge part of me felt like that was resulting in those abnormal pap smears. So it was a lot of things going on in my psyche, and I just wasn't completely sold on cutting into my cervix. I was afraid of having an incompetent cervix. I just didn't want to be cut. when it boils down to it, I didn't want my lady parts to be cut in any. I want to be careful how I word this. I wanted to keep all of my healthy parts. And if we weren't certain that they weren't healthy, that they were in fact cancerous, then why am I cutting it away based on an uncertainty? So that's kind of where I was at the time. I did decide to repeat my pap smear and colposcopy. So yes, another colposcopy. At this time, I also decided to have my IUD removed. I wanted to reduce my risks of abnormal paps, infections, and developing cancer as much as possible. My doctor did not agree with me removing my IUD, but he did, and he collected the pap smear and he performed my colposcopy. Next month in October of 2023, we did go ahead and repeat the pap and the colposcopy. And this time, the pap smear showed HPV, but now again with that high risk 18 HPV, which that type is known to be linked to cervical cancer. But the colposcopy showed no evidence of dysplasia. You understand now why I was so worked up and just not sure of what the hell to do next. Along with colposcopy findings showing no evidence of dysplasia or cancer or malignancy, presents a very challenging scenario. It highlights the nuanced nature of HPV and its impact on cervical health and the importance of thorough repeated assessments. So even though he suggested it and I was on board, we hadn't moved forward yet. So he called me with those results on October 16th after revisiting my specimen samples. And on that same day, we scheduled a pre-op visit for October the 23rd and a procedure on October the 24th. If you all would like a separate video on what it was like going through the procedure, surgery, and recovery, leave a comment down in the comment section letting me know. So I'm usually pretty good. Okay, I'm rather obsessive with checking the online portal, especially my medical records for updates after I leave an appointment, wanting to know if a lab is ready or what have you. So we're now in February. Today is February 1st as I'm recording this. And the last time that I went into my records, I haven't went into my records since my surgery until 2 days ago, so that I can get my dates together and accurately share with you all these tests and results. I did see in his operative notes that the procedure went fine. So it said normal appearing cervix and vagina. Specimens removed. LEEP tagged at 1200, or what I'm assuming meant 12 o'clock. Anterior top hat and posterior top hat removed. Blood loss 5 mLs. Very little bleeding during that procedure. Here's a breakdown of those 3 results. Okay, so that 12 o'clock LEEP showed high-grade squamous intraepithelial lesions present at the endocervical edge. So, what does this mean? This indicates that the LEEP, which is short for loop electrosurgical excision procedure. The LEEP was performed on the cervix and it was found to have high-grade lesions or HSIL. HSIL are serious abnormalities in the squamous and are considered precancerous. So the presence of these lesions at the endocervical edge, meaning they were found at the inner border of the cervix, right at the edge, near the cervical canal, right at the front. These were high-grade lesions. 2, that anterior top hat. I'm guessing it's the excision. When it says top hat, I'm thinking there's a that top part of the cervix cut off into, looks like a top hat. That showed high-grade lesions similar to the first. However, it specifically refers to the anterior part of the cervix. And lastly, that third part, the posterior hat, so the bottom part of the cervix. This one's going a little bit further into the cervical canal. That third part showed intact mucosa, negative for high-grade dysplasia. It also showed a small detached fragment of metaplastic cells with atypia, suggestive of dysplasia. So this finding is more reassuring because it indicates that the posterior part of the cervix or the back of the cervix did not show high-grade dysplasia or significant abnormal cell growth. However, it does show a small fragment of metaplastic squamous epithelium. Again, it did show a small fragment suggestive of dysplasia. That metaplasia refers to the process where one type of cell changes to another type, which can be a response to chronic irritation or inflammation. So atypia, it does suggest abnormal cell appearance, and the dysplasia implies a precancerous condition, although this fragment was described as small. So that kind of takes me back to the reason I wanted to remove the IUD. Again, it's suggestive of possible infection, possible chronic irritation, all again just me wanting to decrease my risk of cervical cancer. So all in all, the LEEP procedure results, it does indicate high-grade lesions. It did not show any high-grade dysplasia, but the presence of atypia does suggest that ongoing monitoring is essential. The decision for me to proceed with the LEEP, after much contemplation and consultations, it was driven on the ongoing presence of those high-grade lesions. The LEEP results confirmed the presence of, again, high-grade lesions, which to me justifies the decision for the procedure. Ladies, let this be a reminder of the critical role of timely intervention in preventing the progression of precancerous conditions into cervical cancer. So what is next? I have scheduled my 6-month follow-up for repeat testing. I'm choosing to reserve the what ifs and the possibilities and focus on the positive aspects and continuing to speak life into my situation. This journey has been challenging. It's been filled with moments of anxiety, decision-making, and ultimately moments of empowerment. I've learned so much about my body, the importance of regular screenings, and the complexities of navigating HPV-related diagnosis. I also have embraced a healthier lifestyle, focusing on my wellness, which I believe played a critical role in my journey. I share my story to encourage open discussions about women's health, the significance of regular screenings, and the power of being informed about our bodies. If you're going through a similar journey, know that you're not alone. Please consult with your healthcare practitioners to understand your situation and explore your options. Remember, knowledge isn't just power, but doing something with that knowledge. Applying that knowledge is true power. So thank you for watching. Please don't hesitate to reach out in the comment section if you have questions. Don't forget to like, share, and subscribe for more updates on my journey and discussions on women's health topics. Take care of yourselves, and I'll see y'all in the next video.